Artificial intelligence, robotics, big data in the healthcare sector. A study was conducted on the entrance of artificial intelligence into the healthcare sector. What was amalgamated from literature reviews but also from stakeholder analysis was that artificial intelligence, robotics and big data brings enormous opportunities but also holds novel risks that are currently opening up for society. In the realm of opportunities of artificial intelligence, robotics and big data, we see that we will have access to amazing opportunities when we start analyzing the big data that is currently conducted around the world and is currently homogenized and brought together. There is a rational precision and human resemblance in artificial intelligence. On the one hand, artificial intelligence can be very precise and offer really tailored, targeted aid. On the other hand, robotics have been starting to resemble human beings and provide aid and care like human nurses. One of the major advantages is that artificial intelligence can be completely corruption-free. The robotics allows an opportunity to not be susceptible to bribes and not be motivated by maximizing utility and financial welfare. There is an enormous potential for novel innovations, and with this comes economic growth. In the risk realm, there are problems of compatibility. So to have human beings being able to navigate around artificial intelligence, robotics and big data. There is this concern of big data and privacy infringements, and with this comes the problem of discrimination and social stratification, to write people off based on the likelihood that is derived from big data due to the knowledge that we can derive these days from genetics or from the likelihood how their life will turn out over time based on what big data says about their habits, but also about the material in their genes, in their gene pool. There is a preponderance problem of artificial intelligence, which will be able to work 24/7, which will be giving the opportunity to really outperform human beings on a constant basis. And there we will need to have human beings still having the upper hand. There is the concern of liability issues and the problem who is responsible if a machine makes a problem. And there is the fear of loss of humanness in the artificial age. Will we care if a robo is taking care of us? Do we want to have psychiatrists being replaced by robos? Or is there a value in true human care, or can this be simply replicated by artificial intelligence? Now I want to go over the points of opportunities and risks in a bit more detail. So the opportunities are this amazing access to healthcare. We do have this larger institutional networks. We can have ICT-driven telemedicine. Artificial intelligence can be brought into remote, desolate areas. Robotics can take over surgeons and have a radiology precision that is really unprecedented. Early warning systems through big data and generating information about big data is possible. And there is this constant big data generation through electronic health recording, which is completely new and unprecedented. And right now we also have the computational power, but also the hierarchical modeling of big data that is completely new and will open up amazing opportunities for analyzing big data. Rational precision coupled with human resemblance allows us to derive inferences from decentralized information collection. And machine learning can compile data and calibrate emotional, mental, but also physical needs of human beings. There's also this opportunity to have a really human resemblance, to have robotics that can give companionship to patients. And so far, the first results show that robotics resembling human beings helps to calibrate psychologically and mentally ill better than actual human psychiatrists, because robotics can be there 24/7 and can collect data on the individual patients and then give really tailored aid. There's also this aging Western world population problem, and robotics provides this outlook that we will be able to take care of elder people with different devices, that they can have the experience of a social compound, and that elder people can have potentially nurses and robotics that take care of them, not only for their physical needs but also for the mental health and emotional well-being. Targeted aid speaks to consumers being for the very first time that you can collect data from consumers and from patients and then derive inferences thanks to big data and the computational power, and really give targeted aid, that people are collecting data on their bodies every single day on their own. So what would happen is people wear a device like a watch, or there are even already clothing that collects data on a constant basis, and you can give then very precise information about the individual needs, and self-monitoring helps then to give really targeted aid. Thanks to ICT revolutions, you can also access information abroad. So information can be sent in if you're in a remote or desolate place, or in a country where the medical conditions are not on the highest standard. Then you can send in your information, and remotely or by algorithms, information can immediately be returned to patients. There's also this tendency that people more and more just look online on Google and search for their conditions and what kind of medical problems they have and what could cure them. And this is new. The scientific community is not sure if this is a good or a bad thing. On the one hand, we see that people really open up. Usually we had a standard classification of medical conditions that was accessible by everyone, but just a doctor could give you say, okay, you're classified as this and this disease. And now with this revolution of people being more interested in their own health, being able to collect more data on themselves, and having access to the internet, and the internet on a constant basis improving in terms of information, that people start defining diseases themselves and step away from medical conditions that are pre-given. That is especially the case in psychological disorders, that people start defining themselves their conditions, and they step away from the standard classification. On the one hand, that's good. On the other hand, researchers and the medical community is not very sure if human beings can really self-diagnose themselves, and there's currently a controversy whether or not the internet should support. So should we have a Wikipedia page just for medical conditions, or should we completely step away from this and say people should not start having a crowd control and crowdsourcing on medical conditions? There is this idea that artificial intelligence, robotics, are completely corruption-free and they are not susceptible to bribes. Maybe the person behind the algorithms or the person who understands algorithms better than others, but the algorithm itself, the robo, is 24/7 can work, but is not going to be susceptible to any bribes, and that allows broad stakeholder engagement, and it allows that medicine becomes more democratized, that there's more access to medicine, to affordable medicine than ever before. But on the other hand, the problem is that there should not be a person bias that is sometimes created in big data, where you see that certain groups are simply more prone to having one or the other disease. And with shedding light at this problem, you enter in the problem of discrimination and social stratification, that you say, okay, because someone lives in a certain area, this person might be more prone to have this and this condition. So on the one hand, you have a democratization. On the other hand, you have the problem of discrimination that can follow from the insights that we derive from big data. Innovation potential, as never before in the history of humankind. We do have diagnostic techniques, we have surgery breakthroughs, we have long-term possibilities to collect data and derive inferences. But the medical costs are also rising exponentially these days. So we have to make sure that there is still a possibility for everyone to reach a certain basic level of healthcare, and that healthcare is provided based on needs and not on the purchasing power of a person. So that is one of the problems of these days, that there is more inequality in healthcare. You can get the best output, the best medical output ever, but that also costs money, and this stratification is a new problem that we have. Economic growth. There is the possibility with these breakthrough innovations that we will have the best economic growth from medicine. If we consider that the Western world population is aging, so there's a lot in healthcare spent in the last few months of your life. With an aging population, there is a market opening up there. There's a market opening from innovations, and there is definitely a market opening up for big data, deriving inferences from the data that is retrieved on a daily basis, that people are starting to collect in self-monitoring devices. And with this, big data might be able to be sold to create a revenue that can then offset the problem that big data-driven information and AI precision cost money on the other hand. What are the major risks of artificial intelligence, robotics, and big data entering the healthcare sector? On the one hand, we do have problems of compatibility. So we need a skilled workforce to understand how to integrate artificial intelligence, robotics, and big data into the medical sector. There is this problem of monopolies and certain healthcare companies really having a strong dominance in innovation. And big data creates the problem of major privacy concerns, the problem of vulnerable populations, of patients who are in need, who sign off on a contract while they are under the influence of drugs or while they are in heavy pain, potentially creates an even starker problem than if we lose control over our big data on a good day at work or when we surf the internet. So really attention to that we are dealing with a vulnerable population, and that big data naturally can lead to discrimination and social stratification. We have to take care of this, that people get tailored medical care and help, but that it is not on a discriminatory or a social stratification agenda, and that people are just written off based on their medical condition or even their likelihood that they will have a certain medical condition. So all over the world there's currently this tiny trend that insurance companies are more and more getting information about big data. So if you have bought cigarettes on your credit card, if you have bought alcohol on your credit card, that might be pegged to your insurance premium, and it can become a problem that people are written off based on where they live. So there's currently need for regulation in that area. We have this problem of artificial intelligence preponderance, 24/7 working robotics and health in the healthcare sector brings this amazing opportunity, but we do have this dominance of artificial intelligence that can take over the healthcare sector, and we need rights to terminate, right to be forgotten, and the right to switch off artificial intelligence when the artificial intelligence becomes harmful to human beings or if errors occur. If errors occur, the question of liability, who is responsible if there is a mistake in the big data, if there is a mistake in the surgery precision by artificial intelligence. And there, currently legal experts and legal scholars are discussing several possibilities. So on the one hand, artificial intelligence could become a kind of a slave for human beings, and if you define it as this, there is a nice legal field and code on how to deal with slaves when errors occur, what to do with them, and currently the idea is to take these legal insights and apply them to artificial intelligence liability risks in the healthcare sector, where artificial intelligence gets so close to human beings. The very last risk that was mentioned is the value of loss of humanness in the artificial age. So the problem that we might be losing humanness through genuine human care in the healthcare sector. How do people psychologically respond if they know that they didn't get treated by a human nurse that really cares, but by a robo? Will this change their perception of the healthcare, and will this change the recovery after a big surgery? We don't know, and in this area I would highly recommend more studies, what it really means to be a human being and what it really means to care about patients and how patients perceive artificial intelligence, robos, and the idea of information derived from their big data on a larger level.